This cream is used to relieve minor muscle and joint pain, such as arthritis, backache, and sprains. It contains menthol and methyl salicylate, which are known as counterirritants. They work by making your skin feel cool and then warm, helping to distract you from feeling the aches and pains deeper in your muscles and joints. It's important to note that this product should not be used on children under 12 years old without a doctor's advice. Be sure to read the label carefully before using it on children between 2 and 12 years old, and avoid using it on children under 2 years old. As for the daily dosage, simply apply a thin layer of the cream to the affected area no more than 3 to 4 times a day. It's best to use it at the first sign of pain to get the best results. Make sure to follow the directions on the product package, and if you have any questions, ask your doctor or pharmacist for guidance. This medication is meant to be used on the skin only, so avoid applying it near your eyes, mouth, nose, or genitals. Be cautious not to touch those areas while the medication is on your hands, and if you do, make sure to flush with plenty of water. It's important to wash your hands thoroughly before inserting contact lenses. If you are using the lotion, spray, or foam, be sure to shake the bottle well before using. You can apply a thin layer of the medication to the affected area no more than 3 to 4 times a day, and make sure to rub it in gently and thoroughly. After applying the medication, be sure to wash your hands unless you are using it to treat your hands. If you are treating your hands, wait at least 30 minutes after applying the medication before washing them. Avoid applying this medication to injured or irritated skin, such as cuts, scrapes, or sunburns. Also, do not bandage or tightly wrap the affected area, as this may increase the risk of side effects. You can cover the area loosely to protect clothing, and if you have any questions, ask your pharmacist for more details. It's important to note that heat can increase the risk of side effects, so avoid applying this medication immediately before, during, or after activities that increase skin temperature, such as bathing in hot water, swimming, sunbathing, or heavy exercise. Wait until your skin has cooled before applying the medication, and avoid using a sun lamp, tanning bed, hot water bottle, or heating pad on the treated area. This product is available in different strengths and with different ingredients, so be sure to read the label carefully to make sure you have the right product for you. If you have any questions, don't hesitate to ask your pharmacist. If your condition lasts for more than 7 days, gets worse, or keeps returning, make sure to tell your doctor. And if you think you may have a serious medical problem, seek medical help right away. Some possible side effects of using icy hot 30% to 10% topical cream may include redness, warmth, stinging, or burning at the application site. If these effects persist or worsen, it's important to notify your doctor or pharmacist. If your doctor has prescribed this medication for you, they have determined that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. However, it's important to stop using this medication and contact your doctor immediately if you experience any serious side effects, such as blistering, swelling, severe redness at the application site, increased or unusual pain at the application site, nausea, vomiting, or ringing in the ears. While it is rare, a serious allergic reaction to this medication can occur. Seek medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching, swelling, especially of the face, tongue, or throat, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of potential side effects, so if you experience any other effects not mentioned here, be sure to contact your doctor or pharmacist. If you are in the US, you can call your doctor for medical advice about side effects, or you may report side effects to the FDA. In Canada, you can also call your doctor for medical advice about side effects, or report side effects to Health Canada. Before using icy hot 30% to 10% topical cream, make sure to speak with your doctor or pharmacist if you have any allergies to menthol, methyl salicylate, aspirin, or other salicylates. This cream may also contain inactive ingredients that could cause allergic reactions or other issues, so it's important to discuss this with your pharmacist. If you have asthma or nasal polyps, it's important to consult your doctor or pharmacist before using this product. Additionally, if you are planning to have surgery, make sure to inform your doctor or dentist about all the medications and products you are currently using. Icy hot 30% to 10% topical cream contains a product similar to aspirin, so children and teenagers under 18 years old should not use this cream if they have chickenpox, the flu, an undiagnosed illness, or have recently received a vaccine. Using aspirin-like products in these cases increases the risk of a rare but serious illness called Reye syndrome. If you are pregnant or planning to become pregnant, it's important to discuss this with your doctor before using this medication. This cream may harm an unborn baby and cause issues during labor and delivery. It is not recommended for use in pregnancy from 20 weeks until delivery, and if it is necessary to use this medication between 20 and 30 weeks of pregnancy, the lowest effective dose should be used for the shortest possible time. This cream should not be used after 30 weeks of pregnancy, so make sure to discuss the risks and benefits with your doctor. If you are breastfeeding, consult your doctor before using this product, as it is unknown if it passes into breast milk. It's important to be aware of potential drug interactions when using icy hot 30% to 10% topical cream dermatological irritants-counter-irritant formulations. Certain medications may alter the effectiveness of icy hot or increase the risk of serious side effects. Always keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's crucial to seek your doctor's approval before starting, stopping, or changing the dosage of any medications. This will help ensure the safe and effective use of icy hot. If this medication is accidentally ingested, it can be harmful. If someone has taken an overdose and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical assistance by calling 911 or a poison control center. In the U.S., residents can reach out to their local poison control center at 1-800-222-1222, and in Canada, residents can contact a provincial poison control center. Always ensure to keep this medication out of reach of children and pets to prevent accidental ingestion. Make sure to keep all your scheduled medical appointments and laboratory visits. These are important for monitoring your progress and making any necessary adjustments to your treatment plan. If you forget to use the cream at the scheduled time, apply it as soon as you remember. However, if it's almost time for your next dose, it's best to skip the missed dose and continue with your regular schedule. Avoid applying a double dose to make up for the missed one. When using icy hot 30% to 10% topical cream dermatological irritants-counter-irritant formulations, it's important to store it according to the instructions on the product package or as directed by your pharmacist. Make sure to keep all medications out of reach of children and pets. Do not dispose of this medication by flushing it down the toilet or pouring it into a drain unless specifically instructed. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this properly. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.